Hey guys, welcome back to my channel. This is Queen Bernadette, also known as Hood Oracle, with another video for you guys. So I wanted to talk about Hashimoto's disease and what exactly is it, so you know that what I'm dealing with on a daily basis, and if you see any deterioration, you know what it's about. You know what's the cause of it, that it's not magic, it's not somebody attacking me, it's because of this disease, okay? Now, the first thing that you need to know is that it's an autoimmune disease, much like lupus, much like type 1 diabetes, which we'll get into because this is according to mayoclinic.org. So the things to know about it is that it affects both men and women, but mostly women. It seems to be more effective on women than it is on men. With men, it does require surgery sometimes, okay? With women, it requires hormone replacement therapy. That's exactly what I'm on, okay? So as the disease progresses, the dosage has to be a little higher and higher and higher because it's a progressively damaging disease to your thyroid, okay? So for those of you that have been experiencing these particular types of symptoms, I want you to get checked right away. You know, don't overthink it, just do it, because if you overthink it, you're going to talk yourself out of it, okay? So it's better to know and them tell you that you're fine than for you to assume that you're fine, and then this progressively gets worse, and then the damage is irreversible. So the first thing to know is that this really does affect middle-aged women more than anything, but you can be diagnosed at any time. So really, I would start checking at around 25 to 30. Okay, I would start checking. It's one of those things that you have to check very, very often. Okay. As I said, men could be affected by this too. And it's actually, when they put you on meds, it's hormone replacement therapy. Okay. So it's basically the thyroid is being attacked by your immune system, and it's damaging the control center that is in charge of a lot of the functions of your body. Okay, so your digestion, which, you know, if you've been constipated, that's a sign of it. Okay, it could be a sign of other things too, but you know, just jot it down as you're listening to this video. Okay, if you're sensitive to cold, that's another sign. If you've been experiencing hair loss, unexplained weight gain, I would check this out. Okay, so let's get into what it says here according to mayoclinic.org. Okay, Hashimoto's disease is a condition in which your immune system attacks your thyroid, a small gland at the base of your neck below your Adam's apple. The thyroid gland is a part of your endocrine system, which produces hormones that coordinate many of your body's functions. In other words, this is command central. Your immune system is attacking command central, okay? Everybody thinks that the brain is command central, which it is, but, you know, your thyroid is kind of like that soldier that delegates, right? Inflammation from Hashimoto's disease, also known as chronic lymphocytic thyroiditis, often leads to an underactive thyroid gland, hypothyroidism. Hashimoto's disease is the most common cause of hypothyroidism. Now, it's called Hashimoto's disease because the first person that was diagnosed with it, even though this affects women more than men, was a Japanese doctor, Dr. Hashimoto. Okay, Hashimoto's disease is the most common cause of hypothyroidism. It primarily affects middle-aged women, but can also occur in men and women of any age and in children as well. So the earlier you get this tested, the more better off you'll be, and the lower the dosage you'll have to take in. Doctors test your thyroid function to help detect Hashimoto's disease. Treatment of Hashimoto's disease with thyroid hormone replacement usually is simple and effective. And I've been fine with this. They increase my dosage, and I'm like, I feel like Superwoman right now. I feel great. Okay, it's like, you know, I am a middle-aged woman. You know, it's like as young as I am. You know, as I kind of sound and act and everything, and my energy, we can't forget I am a middle-aged woman, okay? So this is going to affect me, okay? This tends to also affect Eastern European women because of the low iodide, okay? Even though I consume salt like a motherfucker, okay? I put salt in everything and in copious amounts, okay? And I still have an iodide deficiency because of my Eastern European heritage. My mom has it too, but she has type 1 diabetes, okay? Her parents had diabetes. Her husband had diabetes. Her boyfriend had diabetes, okay? You know, um it seems that, that seems to be the kind of like dark passenger that follows, right? Family history. If you have a family history of anything, I suggest you get checked out, okay? But especially this Hashimoto, since we're talking about Hashimoto's, okay? It's very common, more common than you would think, okay? Alrighty, so symptoms. This is what you got to look out for, okay? You might not notice signs or symptoms of Hashimoto's disease at first, or you may notice a swelling at the front of your throat, which is goiter. Hashimoto's disease typically progresses slowly over years and causes chronic thyroid damage, leading to a drop in thyroid hormone levels in your blood. The signs and symptoms are mainly those of an underactive thyroid gland, which is hypothyroidism. Signs and symptoms of hypothyroidism include fatigue and sluggishness. Okay, there have been times I haven't been able to make videos for you guys because I was just knocked out, okay? Increased sensitivity to cold, constipation, pale, dry skin. I'm not this pale, guys, okay? I have a little bit of melanin in me, just a little bit. I am part Puerto Rican, but because of the Hashimoto's, I'm a little paler than normal, okay? A puffy face. My face is a little puffy. It is, okay? Brittle nails. I used to be able to grow my nails. Now they can't get past the point and they break. I had to keep them at a certain length. Hair loss. It doesn't look like it, but, combing out my hair every morning, it's like, some hair does come out. I'm going to be honest, okay? It does come out in the shower sometimes, all right? And that's one of the signs, okay? I'm being completely honest with you guys. I don't have anything to hide, okay? Enlargement of the tongue, which thank goodness I don't have that, okay? You're not going to have every single one of these, and if you do, then you really do need to get checked out, okay? Unexplained weight gain. I've always been kind of a heifer when I eat and everything, so I was kind of attributing it to that, but, when my doctor, and a good doctor, guys, is a blessing, okay? Having a good doctor is really a blessing. Somebody that actually listens to you and doesn't treat you like you're a hypochondriac, okay? And listens to your concerns. I am so blessed with a good doctor. God bless her. Please protect her. Bubble wrap that woman. I love that little lady, okay? She is a wonderful doctor, okay? If y'all lived in my area, I would refer you to her. I would. She's that good. Muscle aches, tenderness, and stiffness, which I have been having that, when I wasn't on the medication. I would get stiffness in my joints, right? Especially my left knee and my knuckles, okay? And especially in my pinky. For some reason, my pinky, I don't know why. Joint pain and stiffness, which this is kind of, you also have to get checked for RA. If that's one of the symptoms that you're suffering from, get it checked. Ladies and gentlemen, get it checked, okay? Don't be proud. Go get it checked. Especially you gentlemen, you tend to be very proud. You wait until the thing is like catastrophic before you go get checked out. Okay? If any of y'all listening that are men, that are DMs of the women that are listening to this, get checked out. They would thank me for telling you to get everything checked out. Okay? Get it checked out. Okay? We need y'all in one piece. Okay, muscle weakness in varying degrees. I've had that. Okay, in the legs, I've lost my balance a couple of times. At some point, because I was losing balance in my legs, I thought that I was having what my sister had died from, which was MS. which is a progressive muscle deterioration disease. Okay. Excessive or prolonged menstrual bleeding. Okay, that means if it lasts more than 7 days. Okay, the average is 5 to 7 days. Okay, sometimes less, sometimes the full 7 days. But if it's past 7 days, then there's a problem. Okay, and if it's a little heavier than usual and you're bleeding through pads like anything, or bleeding through your tampons like anything, it's a problem. Okay, because don't forget, one of the systems that the thyroid is in control of is your reproductive. Okay, so for a while I wasn't getting my period, and then I was on the medication and I got my period again. Okay, so that's saying something, that this was completely linked. Okay, depression and memory lapses. There are times that I'll get on a video, I'll get on live, and I'm like, what the fuck was I just talking about? I'll walk into a room. What the hell did I come in here for? And I thought it was part of getting old, guys. Yeah, but until I went to the doctor and they did the full panel and asked for the full panel. I'll show you in a later video what a full panel looks like. It's T3, T4, the LS, is it LSH? They check your urine as well. They check your blood. And now I'm way past the safe stage. So it's like, because I'm 44, I'm not getting younger. I'm getting older, okay? As young as I am in energy, I'm still physically a middle-aged woman, like I said, okay? So the memory lapses, it'll be like, I'm sorry, what were you just saying? It's not, and people are thinking that it's a hearing issue, right? Which, my hearing is not the best either. My left ear is not the best. And I was thinking that's what it was, because your brain is connected to your ears, there's that connection there, what you hear, you process in the brain, right? So I'm thinking that's what it was, and I'm getting my hearing checked and everything, and while there's a slight hearing loss in the left ear, it's really not bad enough to require a hearing aid or anything like that, even at my age, right? So, I really can't blame anybody else but my love of rock and roll. I can't blame anybody else but my love of rock and roll. I love my rock and roll concerts. I got to be up there right in the front and, cause damage, right? So, the memory lapses. The memory lapses are not that bad now since I've been on the medication. It really does help me, okay? When to see a doctor. See your doctor if you develop these signs and symptoms. Tiredness for no apparent reason. This is why I don't want you to assume that it's spell work every single time, okay? If you get into that loop of thinking, you're going to kind of get to be a hypochondriac. You know what I mean? It's like, and I had to check myself with that too, and I'm like, is this spell work? No, this is physical, baby. This is physical. It shows up in your blood work. Get it checked, get it treated, right? We can't make that assumption, okay? Now, if your blood work doesn't show anything, then you can assume that it's something external of your own physicality, okay? But always have it checked out first, all right? Let's see here. When to see a doctor. See your doctor if you develop these signs and symptoms. Tiredness for no apparent reason, dry skin, and your skin will be very itchy when it's dry. A pale, puffy face. You've seen me on camera. No matter how much makeup I put on, it's like it seems that, that puffy face shows through, I'm usually not this pale, okay? If you would have seen pictures of me a little younger, I had a beautiful little light caramel complexion, okay? Or olive complexion. So this is due to the disease, right? It makes my face puffy and pale. And constipation. I also have IBS, so, those are kind of linked. I'm a little bit of a hot mess. Okay. Guys, I have a medical issues. Okay, I have my IBS. I have also an esophageal issue. I can't have coffee, but I drink it anyway. Look, man, I'm not gonna stop living. Okay, just give me the medication, and I'll work my way around it. That's typical tourist thinking, right? I still want to live my life. Just give me the fucking medication, and I'll fucking work my way around it. You'll also need to see your doctor for periodic testing if your of your thyroid function. If you've had thyroid surgery, that's for the men. Okay. Especially if you had the thyroid removed. Okay. If you've had treatment with radioactive iodine or anti-thyroid medications. Okay. Or if you've had radiation therapy to your head, neck, or upper chest. Okay. If you have high blood cholesterol, which, yep, I do, talk to your doctor about whether hypothyroidism may be a cause. And if you're receiving hormone therapy for hypothyroidism caused by Hashimoto's disease, schedule follow-up visits as often as your doctor recommends. It's important to make sure you're receiving the correct dose of medicine, which is imperative. If you even miss one dose, it could really fuck you up. I'm going to tell you from personal experience, if you miss even one dose, it could fuck you up, okay? Over time, the dose you need to adequately replace your thyroid function may change. It changed from 25 to 50 for me, okay? Let's see here. Hashimoto's disease is an autoimmune disorder in which your immune system creates antibodies that damage your thyroid gland. Doctors don't know what causes your immune system to attack your thyroid gland. Some scientists think a virus or bacterium may trigger the response, while others believe a genetic flaw may be involved. I am Eastern European, okay, so I do believe that it's genetic, okay? A combination of factors, including heredity, sex, and age, may determine your likelihood of developing the disorder. Okay? These factors may contribute to your risk of developing Hashimoto's disease. Women are much more likely to get Hashimoto's disease, more than men. Okay? Age. Hashimoto's disease can occur at any age, but more commonly occurs during middle age. Don't forget, you're almost to your change of life. 10 or so years away. So this thing is going to potentially happen. This is why you got to stab it off at the pass. Heredity. You're at a higher risk for Hashimoto's disease if others in your family have thyroid or other autoimmune diseases. Okay? Other autoimmune disease. Having another autoimmune disease such as rheumatoid arthritis, type 1 diabetes, or lupus increases your risk of developing Hashimoto's. Radiation exposure. People exposed to excessive levels of environmental radiation are more prone to Hashimoto's disease. I wanted to get into this, okay? You guys know that I'm going to give you a little geography lesson because that's directly linked to this. I'm Eastern European, as you know, and Ukraine used to be part of the Soviet Union, okay? And the Ukraine is very, very close to Chernobyl. Okay, not close enough, to really do damage, but there's residual. Okay, so anybody that's from that area, probably unbeknownst to them, has kind of had that in their genetic code. Okay. So no matter how far away you are from that site, okay, it's in around Chernobyl. You still can't you can't like thrive there, okay? So it's in the soil, it's in the air, it's in the water, okay? So it's gonna kind of spread out, okay? And even though it's not as bad, the farther out you are, there's still remnants of it, okay? So that could be a contributing factor as well, okay? Don't forget my grandparents were both from Kiev, which is the capital of Ukraine, okay? And grandpa and grandma, both Ukrainian, okay? both from the same part of Ukraine. Okay, so that is still a factor, I believe. Okay, this is my personal opinion. I do believe that contributed to it as well. Okay, it's going to be passed down. Okay, so I really have to be on the ball when I have my baby and everything. I have to be really on the ball when it comes to this because, as a woman, you do tend to be a little wary of things. I have certain things that are up with me. I have my scoliosis. I have, the IBS, as I have I think it's called GERD, the thing that I have, that I can't consume certain foods because of the reflux. So I had these couple of ailments here that, look, my life is an open book. I don't hide anything from you guys. This is what it is. If my testimony can help you, then, I'm doing my job then. If I can prevent you from going through any further damage unnecessarily, then I'm doing my job. So I do feel that that's a contributing factor. Okay. Complications. Now we got to get to the good and the bad. Okay. Left untreated. This is why I'm urging you to get this tested. Okay. And don't let them tell you, I'm going to tell you right now, don't let them talk down to you and tell you that there's nothing wrong. There's nothing wrong. Look, if you really feel that this is a problem, then I would just go past your GP and go find either a second opinion or go straight to an endocrinologist that's 5-star rated. Look for a 5-star rated one. You don't waste your time with anything less than that, okay? This is your endocrine system we're talking about here, okay? Don't let them talk to you like you're a hypochondriac, okay? They tend to do that with women, okay? They tend to do that, and I don't like that shit, okay? That's why I'm so glad that I found a doctor that is so thorough, and she's a woman, okay? So she understands, she gets it, okay? Alrighty, so left untreated, an underactive thyroid gland or hypothyroidism caused by Hashimoto's disease can lead to a number of health problems. Goiter, which is the swollen neck, okay? Constant stimulation of your thyroid to release more hormones may cause the gland to become enlarged, a condition known as goiter. Hypothyroidism is one of the most common causes of goiters. It's generally not uncomfortable, but a large goiter can affect your appearance and may interfere with swallowing or breathing, okay? Heart problems. Hashimoto's disease may also be associated with an increased risk of heart disease, primarily because high levels of low-density lipoprotein, cholesterol, or the bad cholesterol, can occur in people with underactive thyroid gland or hypothyroidism. If left untreated, the hypothyroidism can lead to an enlarged heart and possibly heart failure. You guys, this is serious, okay? Mental health issues. Depression may occur early in Hashimoto's disease and may become more severe over time. Hashimoto's disease can also cause sexual desire or libido to decrease in both men and women and can lead to slowed mental functioning. You really got to get this checked, okay? There's also something called Myxedema, which is rare, but this rare life-threatening condition can develop due to long-term severe hypothyroidism as a result of untreated Hashimoto's disease. Its signs and symptoms include drowsiness followed by profound lethargy and unconsciousness. A myxedema coma may be triggered by exposure to cold, sedatives, infection, or other stress on your body. Myxedema requires immediate emergency medical treatment. Now, for those looking to have a baby, okay? Babies born to women with untreated hypothyroidism due to Hashimoto's disease may have a higher risk of birth defects than do babies born to healthy mothers. Doctors have long known that these children are more prone to intellectual and developmental problems. There may be a link between hypothyroid pregnancies and birth defects, such as a cleft palate, okay? A connection also exists between hypothyroid pregnancies and heart, brain, and kidney problems in infants. If you're planning to get pregnant or if you're in early pregnancy, be sure to have your thyroid level checked. Now, I went to the doctor the other day, okay? And, I've been talking about spiritual pregnancy and all of this stuff and, wanting a baby with my masculine and everything. If he's listening right now, baby, don't worry. I'm on it. Sweetheart, don't worry. I'm on top of this. You don't have to worry. And I know you do worry about me and I love you for that. But mama will take care of the womb and our baby, okay? So don't worry about that, okay? I'm not pregnant right now. I'm just saying, when that day comes, I'm going to be on top of it. Okay, sweetheart. Yeah, I'm going to close this out here. So I'm going to actually take this to another room so that I can speak freely. Hold on. I forget sometimes, even though she's an older lady, she acts so young and everything. So I kind of get that young energy from her. So I'm going to go in here. Okay. So, alrighty. As we were, okay. A connection also exists between hypothyroid pregnancies and, okay, I already read this to you. Okay. So yeah, if you're planning on getting pregnant with your masculine, they are going to recommend an endocrinologist be on top of this, okay? My GP is on top of this whole situation with me right now. I'm not pregnant. So when I do become pregnant, I do have to have an endocrinologist work with me because also I'm an older lady. High risk. Okay. So there's a lot of factors that I have to, it's kind of a special case, right? But I don't care. I want a baby. I don't care. I don't give a fuck. I want my baby with my masculine. I don't care. Just do whatever you have to do on your end, and I'll do whatever I have to do on my end. I want my baby with my masculine. So if he's listening, yes, baby, I want a baby with you. So diagnosis and treatment. Okay. I didn't see this part here. Okay. Now, I'm going to tell you what diagnosis and treatment is because of, the fact that I was diagnosed and being treated. What they usually do is they run you a full panel. They get some blood work done. They usually have the information like within 24 hours. Okay. So you don't have to wait that long. Okay. And a lot of the insurances, they have the apps that you have on your phone, which give you immediate access to your medical information, which is really, really wonderful. Okay. I just love the idea. Okay. And they also get a urinalysis. All right. Now, what I am going to do in a future video is obviously I'll block out my information for, privacy purposes and everything, but I'm going to show you what the levels are. Okay. I'm not going to show you my numbers, right? But I'm going to show you what the names of the things are that they look for in a complete panel so that you know what to ask for, okay? If you don't ask, they don't test for it, okay? They also refer you to get a sonogram, which I had today, of your neck, which I thought it was going to be just the thyroid, but they checked the lymph nodes. They checked that whole neck, honey. She was like, turning my head every which way, move up, move down, close to me, far from me, so, at one point though, I'm going to be honest with you guys, I do feel like there's a bit of an issue with my left, I don't know what it is. I don't know if it's a tonsil. I think it's the left. I think it's the tonsil because it's all in the back of my throat. It feels a little weird. And when she was running the little scanner over it with the jelly and everything, it's a warm jelly that they put on you, okay? It's a little runny, the jelly, too, so okay? I'm going to tell you that left one, it's a little bit of an issue, and I'm going to be honest with you guys, okay? I was, when you're close to looking at the screen, we all do it when we get a sonogram, right? We look at the sonogram, right? And that had several little red spots at a certain area. So I'm a little concerned. I'm not going to be, una brava. I'm not going to be, pretending that I'm a big hard ass, Yeah, I'm a little concerned. Yeah. I'm going to be honest with you guys, because when you see any little arrows or red spots or, whatever, you get a little concerned. Okay. I know they can treat it. I'm a Taurus, and the way us Tauruses kind of think is like, look, man, cut what you got to cut. Give me medicine for what you got to give me medicine for. I want to go on about my life. That's how we think. We're very practical. Okay. We don't sit and bellyache about it too much. No. I want to live my life again. So do what the fuck you got to do. I trust you. You're the doctor. You went to school for this. Do what you got to do. Right. So that's kind of what I'm going to have as my thinking. Right. But I hope that this has been helpful for you guys. I really want to help my ladies, especially my middle-aged ones, because you seem to be affected by this the most. But if you're 25 and up, I would start getting this checked. Younger, if you're already experiencing any of the symptoms that are here. All right, guys. So I'm going to let you guys go. God bless you guys. Reach out with any questions. I'll send you links if you need. And, I love you guys, and I want you in one piece. Don't bypass, because you feel strong and you feel like everything is fine, that you're fine. Okay. Just, it doesn't hurt to get this taken care of, especially if you've been having any of these typical symptoms. All right, guys. I've talked your ear off enough. Love you guys, and I will talk to you soon. God bless.